how did you find me?
Well, I live in Pennsylvania, firstly, and I had a TMJ problem that was not really addressed properly at all. So my bite was off, and someone I know here referred me to you.
Mm-hmm.
And
okay, so there were a couple of things that we noticed right away. One, you had a head tilt, okay?
Right.
Which the other doctor couldn't quite get fixed, and
right.
we were concerned about that. Two, we found that you had a sleep breathing disorder.
Correct.
Okay.
Yeah.
Which had gone previously undiagnosed.
Correct.
Okay. And then we agreed on a pathway to help open up your breathing so
right.
that you could sleep better. And so we started on that path. We started with Vivos, okay?
Right, and it was to give me a better occlusion too.
Right, but that was going to be the end result.
Yeah.
But initially we were looking at trying to get your breathing more under control.
Yeah.
So when we started that process, that took a few months to try to get some of that expansion done. We then switched over to using clear aligners.
Correct.
Okay. So how long have you been in the clear aligners now?
Like, I don't know, a little over a year, maybe.
Well, I don't think it's been a year. I think it's been.
Well, there was a little time where we were in a holding pattern, so.
Yeah, well, but we started with the Vivos appliance. That got us a certain way, but we literally expanded that as much as we could.
Right.
And to go into the clear aligners, we didn't have the same restrictions, so we could control this. You had some concerns about how you were going to look, where the front teeth were going to go, because you've had a lot of dental work done.
Right.
And we didn't want to have to redo all that.
Correct.
Okay. So now that we've finished with the clear aligners, we've done one crown, and we've balanced your bite. Okay. Would you say that you feel like your TMJ issue is more under control?
Absolutely. Yeah, my sleep is better. My TMJ pain is much better, and I have what I feel like is a real solid occlusion now when I bite.
Yeah. Okay. Yeah, because you were sliding around in the other one a bit, so we were aiming to get this resolved for you.
Yeah.
Okay.
Yeah.
Would you?
So it was worth it all.
You're sweet. So what would you say to somebody who's having some TMJ issues and is hesitant?
I would say that Dr. Brenner knows what she's talking about, and she has years and years of experience and is very multidimensional in her thinking and her education.
That's a very nice compliment.
Well, it's true.
So I know that you had some concerns about the outcomes, which I promised you we would get there together, because it is a collaborative.
You did, and I had, I'm just always a little, I like to worry a lot, so I did my share of worrying, but it all worked out.
Yes, I think it did too.
Yeah.
All right, so we're still going to be monitoring you. It isn't like we're just sending you off into the sunset here. You know me, I like to make sure that all my little ducklings are doing okay.
Right, exactly.
Yeah,
and you really gave me good support, like when you put up with me when I, had worries or whatever, and you gave me good support in between visits when I needed it, and did all the right things for me.
And I think I upheld those promises to you.
You did.
Yeah, right. Yeah. And that's the biggest thing when somebody goes to someone, they don't know whether to trust them or not, because there are people out there that sometimes think they know what they're doing, and some of them are okay. And then we have somebody like you who is a little more complicated. You had some multi-level issues going on, and we had to kind of resolve each one of them in a sequence in order to get you where we've got you today.
Right.
Okay.
Correct.
All right. Is there anything you'd like to add?
Thank you.
Oh, you're most welcome.
Thank you very much for everything you've done for me.
You're most welcome.